Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to the channel. Today we will talk about the anatomy of the internal nose, which is also called as nasal cavity. Uh, we have talked about already about anatomy of external nose. The link for that video is there in the description, so you can check it out there. Today we will talk about internal nose. You are requested to subscribe and share the channel so that you are not going to miss any videos. This internal nose, as I just mentioned, it is also called as nasal cavity, and this nasal cavity is divided into nasal cavity right and left side of the nasal cavity by the nasal septum. Internal nose or nasal cavity, it has got two parts. One is skin-lined portion, which is called as nasal vestibule, and as it is skin-lined, so it has got the adnexa of the skin, that is sebaceous glands and hair follicles, which are also called as vibrissae, and so that boil can occur only in the nasal vestibule, because boil by definition we know that this is the staphylococcal infection of the hair follicles. We call it as furunculosis as well. So it can occur only in the nasal vestibule, while the nasal cavity proper is that portion of the internal nose or nasal cavity which is mucosa lined. And this nasal cavity proper, it has got a lateral wall, it has got a medial wall, it has got a roof, it has got a floor, while anteriorly it is exposed to the exterior through anterior nares, and posteriorly it is communicating with the nasopharynx through posterior nares or the choana. The roof of this anterior nasal cavity proper, it has got three parts. One is anterior sloping part, which is formed by the nasal bones. Then is middle horizontal part, which is formed by the cribriform plate of the ethmoid. And then there is again a posterior sloping part downwards towards the nasopharynx, which is formed by the body of the sphenoid. While the floor of this nasal cavity, it is formed by the palatine process of the maxilla in its anterior 3/4, where this my pointer is there, and posterior 1/4, this is formed by the horizontal process of the palatine bone. So mostly it is formed by the palatine process of the maxilla, anterior 3/4, and posterior 1/4 is formed by the horizontal process of the palatine bone. Nasal septum, it divides nasal cavity into two halves, right and left, and this nasal septum, it has got three parts. One is columellar septum or columella, which is formed by the medial crura of the lower lateral cartilages covered by the skin, and the portion just behind that is consisting of only the mucosa. There is no cartilage in between, so that is what it is called as membranous septum. And then behind that is the what we call as nasal septum proper, which again consists of osteocartilaginous framework. Mainly is the septal cartilage, which we also call as quadrilateral cartilage. Posteriorly it is formed by the perpendicular plate of the ethmoid, and posteriorly in the bone, which we call as vomer. Then minor contributions are there posteriorly from the rostrum of the sphenoid bone. Then minor contribution in the floor is from the crest of palatine bone and crest of maxilla, anterior nasal spine of the maxilla, and superiorly the nasal spine of the frontal bone and crest of the nasal bones also have their contributions in this nasal septum. The blood supply is from, again, just like external ear, it is there from the internal carotid system, that is anterior ethmoidal and posterior ethmoidal arteries, and the rest of the arteries, they are mainly the branches of facial artery, and that is from the external carotid system. Clinical significance is antero-inferior part of the nasal septum, which is in circle here in this picture. This is called as Little's area. The importance of this Little's area is that mostly the anterior epistaxis occur from this area. The reason being that here is confluence of a blood vessels, which we call as Caselbach's plexus, and this Caselbach's plexus is having the contributions from the superior labial artery, from the greater palatine artery, then branch of the sphenopalatine artery, and from the internal carotid system only anterior ethmoidal artery. So these four arteries, they constitute the Caselbach plexus, which is situated at Little's area, which is the area at the antero-inferior part of the nasal septum. Posterior ethmoidal artery, which is also a branch from the internal carotid system, it supplies the posterior part of the nasal septum, but if you trace it, as you can see in the picture as well, that it does not reach up to the Little's area, rather it finishes far behind. So it supplies the posterior half of the nasal septum, but this posterior ethmoidal artery, it does not contribute to the Caselbach plexus at Little's area. Nerve supply is from olfactory area is there, so olfactory nerve is there, then anterior ethmoidal branch of the nasociliary nerve, nasopalatine nerve, and anterior superior alveolar nerve, they supply there. Lateral wall of the nasal cavity proper, it has got a contributions from ascending process of the maxilla, then nasal bone, ethmoids, medial part of the maxilla, inferior turbinate, which is a separate bone, perpendicular plate of the palatine bone. In the nasal septum, the posterior posterior part of the nasal septum proper is formed by the perpendicular plate of the ethmoid bone, while the perpendicular plate of palatine bone, it forms a part of lateral wall of the nasal cavity proper, and then posteriorly is the medial pterygoid plate. The lateral wall of the nasal cavity, it is marked by, or you can say the hallmark of lateral nasal cavity, lateral wall of the nasal cavity proper is three bony projections. Two are the part of ethmoid bone, that is superior turbinate and the middle turbinate. They are part of the ethmoid bone, and the lower one is called as inferior turbinate, which in itself is a separate bone. Sometimes superiorly there can be a fourth turbinate, which is known as concha suprema, and below and lateral to each turbinate is its corresponding meatus. So there will be three meatuses: superior meatus, below and lateral to the superior turbinate, middle meatus, below and lateral to the middle turbinate, and inferior meatus, which will be below and lateral to the inferior meatus. So here in the picture you can see that this is the inferior turbinate, and below and lateral to is this inferior meatus. This is middle turbinate, and below and lateral to this is the corresponding meatus, which is middle meatus. And then is the superior turbinate, below and lateral to this one is the superior meatus. Now in the picture you can see that this inferior turbinate, it runs in whole length of the lateral wall of the nose. So inferior meatus will also run along the whole length of the lateral wall of the nose, nasal cavity. While this middle turbinate, it is attached to the posterior two-third. It does not run in whole length, rather it is attached to the posterior two-third. So similarly is the middle meatus, while superior turbinate is attached to the posterior one-third of the lateral wall of the nasal cavity. So same is the dimensions for superior meatus. So in anterior rhinoscopy with nasal speculum, when we are looking at the nose anteriorly, we can see the inferior turbinate and inferior meatus. We can see the part of middle turbinate and part of the middle meatus, but on anterior rhinoscopy with nasal speculum, we would not be able to see the superior turbinate and superior meatus because it is attached to the posterior 1/3 of the lateral nasal wall. Then above the nasal vestibule and in front of middle meatus is an area which we call as atrium, and above this atrium is what we call as agar nasi. This agar nasi is a prominence which generally contains anterior ethmoidal air cells. Agar nasi cells are the most anterior ethmoidal air cells lying anterolateral and inferior to the frontal recess and anterior and above the attachment of middle turbinate. They are located within the lacrimal bone laterally, therefore have lateral relations, that is the orbit, lacrimal sac and nasolacrimal duct. Now you must have an idea that sphenoethmoidal recess is above the superior turbinate. So this is the superior turbinate here, which has been cut. All the turbinates are being cut to show the details of the meatuses. So this is the attachment of the inferior turbinate, this is the attachment of the middle turbinate, and here is the attachment of the superior turbinate. So above and behind the superior turbinate is sphenoethmoidal recess, then is superior turbinate here, then below this superior turbinate here will be the superior meatus, then is middle turbinate here, below middle turbinate will be middle meatus, so this is the middle meatus, then is the superior turbinate, inferior turbinate in whole length of the lateral wall of the nasal cavity proper, and below is the inferior meatus. So this is the detailed description of the lateral wall of the nasal cavity. Again I repeat, sphenoethmoidal recess, then is superior turbinate, then is the superior meatus, then is the middle turbinate, then is the middle meatus, then is inferior turbinate, and then is the inferior meatus. In the inferior meatus, nasolacrimal duct opens. Now this middle meatus is very important as far as the pathophysiology of rhinosinusitis is concerned, because this is the middle meatus in which there is anterior group of paranasal sinuses, which includes frontal, maxillary and anterior ethmoidal air cells and middle ethmoidal air cells if present. All these anterior group of paranasal sinuses, they open here in the middle meatus, while posterior ethmoidal air cells, they open in the superior meatus, and this sphenoid sinus, it opens into the sphenoethmoidal recess. So this is the blood supply of the lateral wall of the nasal cavity. Again, there is posterior ethmoidal, then anterior ethmoidal artery also supplies branches of sphenopalatine, then branches artery of the inferior meatus, greater palatine artery and facial artery. They supply the lateral wall of the nasal cavity. Nerve supply is from the olfactory nerve, then anterior ethmoidal nerve and some other nerves. You can check it out from the book also. So they supply there. Now it has got an autonomic nerve supply as well, and the sympathetic supply is basically from the superior cervical sympathetic ganglion, which from where the branches go to internal carotid plexus, and from there it goes to the Vedian nerve, and Vedian nerve is the nerve where parasympathetic also joins, and together they go to the sphenopalatine ganglion. Parasympathetic supply is from the facial nerve, which leads to the branch of greater superficial petrosal nerve. This greater superficial petrosal nerve with the sympathetic branch from the internal carotid plexus forms the Vidian nerve, and then ultimately they go to the sphenopalatine ganglion. These nasal branches from the sphenopalatine ganglion, they supply the nasal cavity. Sensory nerve supply is from the trigeminal nerve, which carries the common sensations via its two branches, that is ophthalmic and maxillary divisions, while special sensory supply, which is related with the smell, that is carried via the olfactory nerves. The lymphatic drainage is from the internal nose is to the upper deep cervical lymph nodes, which can drain the nasal cavity directly or via the retropharyngeal lymph nodes. Now, osteomeatal complex, whenever we will talking about rhinosinusitis or the nasal operations for the sinuses, again and again you will come across with this terminology. So osteomeatal complex, this is the middle meatus, is the space below and lateral to the middle turbinate, and it is often functionally referred to as the osteomeatal complex. It contains the drainage pathways for the anterior group of paranasal sinuses. The middle meatus is the area which is most commonly involved in the pathogenesis of chronic rhinosinusitis. So this is the diagrammatic representation of this osteomeatal complex, that this is the middle turbinate, the attachment of the middle turbinate. Below and lateral to this middle turbinate is, this is what it is called as middle meatus. So here you can see what we call as a bulla ethmoidalus. It is nothing but one of the most consistent and largest of the anterior ethmoid air cells. It is located within the middle meatus, directly posterior to the uncinate process. So this is a bony projection which is called as uncinate process, which is present there in the middle meatus. Posterior to this one is anterior ethmoidal air cells, which we call as bulla ethmoidalus, and posterior to this one is the basal lamella of the middle turbinate. So this bulla ethmoidalus is posterior to the uncinate process and anterior to the basal lamella of the middle turbinate. The infundibulum is an air containing space that is bounded medially and below by the uncinate process. The lamina papyracea is here laterally, and here should be the orbit, and posteriorly is the bulla ethmoidalus. Hiatus semulunaris is two-dimensional, defining the extreme medial opening of the infundibulum, and this is lowest as compared to the infundibulum. It is a crescent-shaped gap between the posterior free margin of the uncinate process and the anterior wall of the ethmoid air cells. And here is that most of the anterior group of paranasal sinuses open, and their secretions then go to the middle meatus. Uncinate process is a bony projection, as I said. It forms the floor and the medial wall of the infundibulum, and it is sagittally oriented. It is approximately 3 to 4 centimeter wide and 1.5 to 2 centimeter in length. So this is a transverse section of the same, that this is the bulla ethmoidalus. This is the uncinate process which forms the floor and medial wall of the infundibulum, and the deepest part of the infundibulum is hiatus semilunaris, in which the anterior group of paranasal sinuses open. Then while discussing the external nose, we mentioned these danger areas. So one is externally is the danger area, that is the lower part of the external nose and the upper lip, and the infections from here, they can go intracranially through the anterior facial veins which are connecting with the ophthalmic veins, and these veins are valvulous. So the infection can go intracranially and can cause cavernous sinus thrombosis, which is a life-threatening condition, or meningitis. Then inside the nasal cavity or in the internal nose, there is another danger area which we know, that is the olfactory area, because there is the cribriform plate through which these nerves are traversing towards the intracranial structures. So infection may spread through this olfactory area into the meninges along the pia and arachnoid sheaths of the olfactory nerve, and can cause meningitis or cavernous sinus thrombosis, which are life-threatening conditions. So with that, we come to the end of today's discussion. You are requested to subscribe the channel and like and share with your friends. And thank you very much for watching.